everybody hear me okay? All right, great. As people come in, we have staff who can help them find their way to seats and sign in. Welcome everybody. My name is Claudia Lennhoff and I'm the Executive Director of Champaign County Healthcare Consumers. And we are a navigator organization. That's not all we do, but we definitely do healthcare navigation. And so we can help people sign up for health insurance through the marketplace, Medicaid as well, and we also do Medicare, but that's not tonight. First of all, I just wanted to, I'm just going to be making some remarks before I turn it over, but the first thing is just to make sure that everybody has an agenda packet. The agenda is your guide for this meeting, so this is the order that we'll follow. And then the presentation that we're doing, you have it in your packet as well. And then we will also, in a few days, maybe sometime next week, we will post a recording of the meeting so that people can see that. We'll send out emails. So that's the other thing with the sign-in sheet. If you want to stay in the loop about what's happening, because there's a lot happening right now with marketplace stuff. And so if you want to stay in the loop, at least please sign in with your name and maybe your email. And please try to write legibly if you can. And then feel free to get up whenever you want and help yourself to refreshments at the back. And then if you need to use the restrooms, you just go out the back door and then they're over across the hall. And before we get really started, I just wanted to ask a few questions of the people who are here who are not on staff. How many of you currently have a marketplace plan? Okay. Oh, or are you here for somebody who has a marketplace plan? Okay. And how many of you are paying attention to the news and are freaked out? Yeah. We're with you. We're with you. It's very reasonable to be concerned right now. Okay. Well, I just want to give a little bit of context for what's happening this year that's different than previous years. Okay. First of all, on the positive side of things, the state of Illinois is now running its own marketplace. In the past, when the Affordable Care Act was created and the marketplace was created, states were given the option of developing their own marketplace or partnering with the federal government to use healthcare.gov. And so Illinois has been working on their marketplace, and this is the first year that marketplace consumers will be going to the Illinois marketplace, which is Get Covered Illinois. You'll hear all about it. The other context that I wanted to provide, I'm sure many of you are aware of this, and that's that Health Alliance is going away. So Health Alliance has been in every type of insurance in our community, whether marketplace, Medicare, employer-based health insurance. We're feeling it too. We've had Health Alliance for years and years and years and a really good plan, and it's going away, so we're having to choose a different company to provide our coverage. And then the big piece of it is that when the partisan budget bill, known as the One Big Beautiful Bill Act, was signed into law July 4th, it really decimated funding for health insurance, all kinds of health insurance. I'll just say this. So we're a 501c3. My comments are not based on partisan politics. They're based on health policy and factual information. What I will tell you is that the decision that is affecting a lot of people, or fixing to affect a lot of people with the marketplace, to not extend the enhanced premium tax subsidies. That's the financial assistance that has really helped make these marketplace plans affordable. The decision to let those sunset and not extend them was not a health policy decision. It was a decision based on other things, just like the decisions to cut Medicaid. And the One Big Beautiful Bill Act represents the largest transfer of wealth in our nation's history from lower and middle class people to the ultra wealthy, because those tax cuts for the mega wealthy are now being made permanent, even though the enhanced premium subsidies were allowed to sunset. This is part of how those are being funded. The government shutdown that's happening right now is happening because there are legislators, primarily Democrats, although there's starting to be a few more Republicans talking about this, but they're fighting to try to get the enhanced premium tax subsidies extended to create that more robust financial assistance for health insurance plans. Health insurers had to assume that those weren't going to happen. They also, the market is in flux, and health insurers never want to see that. So there's a sort of, a situation where health insurance premiums are going up because of all the uncertainty, but the financial assistance resources that are tied to people's income are going down. And so that's the circumstance that we're in right now. One thing that I wanted to say, just because I have had people contacting me about this, and I realize that this is something that some people are hearing and believing, there's a lot of disinformation about why this is happening. And one of the things that's being talked about, besides waste, fraud, and abuse, and let's be clear, it's hard to abuse these systems from a consumer perspective, because it's pretty rigorous about showing your income and all of that. It's not being abused. But the other thing that they're talking about is that they got rid of the enhanced premium tax subsidies because undocumented immigrants shouldn't be getting that assistance. Well, they were never allowed to get that assistance. Okay, so it's not about immigrants. This isn't about undocumented immigrants, what's happening. It's not about sound health policy, because sound health policy would mean we cover everybody. We cover as many people as possible, because population health depends on as many people being healthy as possible. Early disease, detection, prevention, all of those things. But so it's not based on sound health policy. The other thing is that when people lose health insurance, our health systems, the providers who provide, the healthcare services, they end up with a lot of uncompensated care, and that can be really difficult, especially in rural areas and places like that. So that's sort of the context. I know you're not here for all of that, but I just wanted to set that as the backdrop for if you end up asking questions. The reason I feel like it was so important to say this is because this is the first year that the state of Illinois is operating its own marketplace, and I want to make sure that nobody misunderstands why these things are happening. It's not because Illinois is operating its marketplace for the first time. These were decisions made at the federal level. So, and if you have questions about that, we'll have a Q&A session later. But my next job up here is to let you all know that we have a couple representatives from Congresswoman Nikki Budzinski's office. Here, she represents the 13th district in Illinois. Many of us are from the 13th district, and so we were very gratified that they wanted to have a presence at our meeting, and because I know they're really concerned about this. We've had meetings with them as well. So Jonathan Williams is here from Congresswoman Budzinski's office, and I'd like to invite you to come up and make your comments, and then we'll get into the substance of the presentation.
Good evening, everyone. Like she said, my name is Jonathan Williams. I work on the district staff for Congresswoman Nikki Budzinski. Unfortunately, the Congresswoman couldn't make it this evening, but she wanted me to come out and say some things on her behalf. So first of all, thank you to Champaign County healthcare consumers for having me and for the important work you do to make sure folks in Champaign and the surrounding areas have affordable health insurance. As you know, this past year has been a difficult year in healthcare. In July, Republicans in Congress and the White House passed their $1 trillion tax package that included some devastating cuts to Medicaid. Some of these cuts include nationwide work requirements and new restrictions for how states finance their share of Medicaid spending. What this will mean is that by 2034, more than 10 million people will be uninsured. As you well know by now, we've been experiencing a government shutdown, which has been going on for almost a month. At the center of this shutdown has been Republicans' refusal to negotiate with Democrats to address the health crisis our country is facing. By the end of the year, the Affordable Care Act's enhanced premium tax credits are set to expire, causing even more chaos in our healthcare system. On November 1st, the open enrollment for the Affordable Care Act marketplace begins, and millions of families are going to face a 114% average increase in their monthly premiums. Because of these increases, more than 4 million people are expected to be priced out of coverage altogether. Congresswoman Budzinski has made addressing these concerns her top priority in Congress. That's why she co-sponsored the Protecting Healthcare and Lowering Cost Act, which would repeal all of the Medicaid cuts from the big bill and permanently extend the ACA premium tax credits. The Congresswoman also led a letter with nearly 100 of her colleagues to Speaker of the House Mike Johnson, urging him to bring the House back to extend these tax credits due to the devastating impact they will have on small business owners and self-employed individuals. Earlier this month, Congresswoman Budzinski partnered with organizations like Get Covered Illinois and Champaign County healthcare consumers to host a storytelling session where constituents were able to share their stories on how the expiration of the tax credits would negatively impact their livelihoods and access to care for all of them and their families. Rest assured that Congresswoman Budzinski is determined to protect health care for working families and continue fighting for you in Congress. If there's anything our office can do for you, please do not hesitate to go to our website, budzinski.house.gov. You can give our DC office a call, 202-225-2371. We also have an office here in Champaign, whose number I don't remember off the top of my head, but I have a pocket full of business cards, so please see me after the meeting and I can give you my personal information. Thank you all so much for having me, and have a great evening.
Thank you. By the way, the district office for the Congresswoman is in our building right across the hallway from us. So talk about great access.
Hello everyone, my name is Ashley Shaw and I'm a healthcare navigator for Champaign County Healthcare Consumers. So some of the goals of the Affordable Care Act was to expand health insurance coverage and improve coverage for those with health insurance, improve access to and quality care of, and control rising healthcare costs. The health reform implementation timeline. Here are some of the things that was implemented over the time. Was adult dependent coverage until age 26. Children could not be denied based on pre-existing conditions. Between 2011 and 2013, increased payments for primary care, and navigators and IPC groups are funded. And then in 2014, there were employment requirements and premium subsidies. And also in 2014, Medicaid expansion and health insurance marketplace came about. Benefits and protections as a result of the health reform allows adult children to remain on their parents' health insurance policy until age 26. Certain preventative services are covered at no cost, including well care visits, contraceptive coverage, and STI counseling with no copays. And protections, no lifetime caps or limits. Insurance companies cannot drop coverage because of illness. And people with pre-existing conditions cannot be denied insurance or charged more. 2010 for children and 2014 for adults. And the medical loss ratio, 80 through 85% of premiums must go to pay medical claims. And making insurance affordable. Insurance was made affordable in 3 ways: providing financial assistance in the form of advanced premium tax credits to those with incomes between 139% and 400% of the federal poverty level, providing out-of-pocket cost sharing to those with incomes between 139% and 250% of the federal poverty level when purchasing silver plans, and expanding Medicaid, which is the public insurance, to those with incomes up to 138% of the federal poverty level. And you can apply and qualify for all of these through the marketplace.
Thank you, Ashley. Ashley Shaw just joined our organization as one of our new funded Get Covered Illinois navigators, and she will be available if you are interested in setting up an appointment with her to talk about your health insurance coverage. And my name is Adani Sanchez. I'm also a navigator at Healthcare Consumers, and I'll be talking a little bit about our new and improved health insurance marketplace website. So instead of going to healthcare.gov, this year we're going to be going to getcoveredillinois.gov. So that's all spelled out, Illinois spelled out, getcovered, all spelled out, .gov. That's how you'll know you're in the right place. It should have that Illinois signet up at the top. And so this is kind of the home page. You'll see that there's also a new phone number as well. So many of you should have gotten some letters, and we'll talk about those a little bit later on. So there are still affordable options available. I know we're talking a lot about some of the things that are changing, but there still are tax credits available for folks. The protections are the same. All plans have to cover doctor visits, hospitalizations, maternity care, emergency room care, and prescriptions. And again, financial help is available, and all the insurance plans have to show the costs in simple language with no fine print. So this is going to be called the Summary of Benefits, and that's going to be a document that's going to be available on Get Covered Illinois. You're going to be able to find that located up at the top of some of the details about the plans. So whenever you're looking for information, like more detailed information about your plan, you'll be able to see that in that Summary of Benefits. So for 2026, plan year 2026, we are moving into Get Covered Illinois. So this is going to be the state-run health insurance marketplace. You can apply for financial help, enroll, and then that all starts on November 1st. So if you're still looking for 2025 coverage, so if you just lost health insurance, yesterday or today, we're still going to be using healthcare.gov through December 31st. So then on November 1st, we're going to be looking at 2026 coverage. So after November 1st, people can start logging on and actually applying and taking, you can apply starting November 1st, but we can already see the plans now. So you can, if you want to go home tonight and have some exciting homework, you can take a look at those plans tonight. You can enroll in the plans in many different ways. You can go online, getcoveredillinois.gov, but they also have a phone line that you can call directly and speak to a consumer representative. So someone who can help you enroll in a plan, look at the plans, and they talk you through it. Open enrollment is from November 1st through January 15th, 2026. And then if you want your health insurance to start on January 1st, you do have to enroll by December 15th. If you enroll after December 15th, it won't start until February. So that's something to keep in mind if you want to make sure to avoid any gaps in coverage. And then again, just like on healthcare.gov, once you enter in your income information, your eligibility results will let you know if you qualify for financial assistance for a private health insurance plan or if you qualify for Medicaid. There's no wrong, they've been telling us over and over, no wrong door. So if you have questions, you can always talk to a navigator, but also if you are interested in just applying or calling them, you can talk directly to them and they can let you know what's going on. Outside of open enrollment, there are things called special enrollment periods. So if throughout the year one of these things happens, like losing your insurance, having a baby, moving, that's a really big one that happens. You move and you might not be able to use your health insurance in the new place you move to. So you want to really double check that. If one of those things happens to you, you have 60 days from the event to log on to getcoveredillinois.gov and enroll in a new plan or add someone to your plan. And who can shop in the marketplace? People who are uninsured, people on individual health plans who like buy them directly from a health insurance company. You can go onto the marketplace. People who purchase dependent coverage from an employer, you might have an option that's more affordable on the marketplace if you are buying dependent coverage. People who have COBRA are also eligible to buy. People who are self-employed, no employees, families, small businesses, and then people who are offered employer insurance, which is considered unaffordable. And the actual limit is 9.9%, 9.96% of your income. So that's a little bit of math that we would do. So we could help you with that and figuring out if it's unaffordable. But the idea is that, yeah, if you wanted to check to see if your employer-sponsored health insurance was considered affordable, you could complete the information on Get Covered Illinois, and they would tell you if you qualify for financial assistance. And to be clear, you must be a U.S. citizen, visa holder, or permanent resident to qualify to buy on the marketplace. People who are undocumented are not able to buy on the marketplace. If you have Medicare or Medicaid, you are already insured, so you would not be eligible to buy a plan with financial assistance on the marketplace. So this is another one of those special enrollment periods as well. So if you become eligible for Medicare next year, we would be able to talk to you and terminate your plan so that you are not double covered, because they will try to charge you for having two health insurances at the same time. People who are currently incarcerated are not able to apply, and then in a change, unfortunately, our DACA recipients are no longer eligible to buy plans on the marketplace. So that was a change because they were considered legal status. They are legal status, but they were carved out of some of the legislation. Marketplace plans cover 10 essential health benefits, which range from prescription drugs, emergency services, maternity care, and mental health, and more. You can see them listed here. And all of these plans that are on the marketplace, they cover things in different ways, and they're categorized at different metal levels. So a catastrophic plan would be a plan eligible for someone who's under 30, and it would cover less than 60% of the total costs of care. Bronze plans cover about 60%, silver about 70%, gold 80%, and then platinum would cover about 90%. Now, this is not every plan that's silver is going to cover 70% of all your services and you just pay 30%. They do things in different ways. This is an overview, a bird's eye view of how much they would cover overall on average. Benefits between levels will change, so things like copays are going to be different. Usually the lower level the plan, the lower your monthly premium. So a bronze plan might be cheaper than a silver or a gold. But your out-of-pocket costs would be higher on a bronze plan because they aren't helping you pay for as much stuff because it's a lower actuarial value. All the plans have a maximum out-of-pocket limit, so that's the ceiling of what you would have to pay, because once you're beyond that ceiling, the health insurance company has to pay 100% of the costs. And all the level plans have to cover the 10 essential health benefits, but like I said, they cover them in different ways. Those catastrophic plans are available to folks under 30. If somebody over 30 is interested in a catastrophic plan, they can apply for an exemption to buy a catastrophic plan. These do tend to be cheaper, but they're not usually cheaper than a bronze plan. So you can talk to a navigator about comparing those. For the marketplace, the catastrophic policies have a deductible of $10,600. So it's basically, think of it again as, this is really only for people who really don't see themselves buying prescriptions, going to the doctor at all. It's really like, I want to only pay $10,600 if I get hit by a bus, and then everything else would be paid by the health insurance plan. So again, this is a very specific situation for somebody. So if you buy a catastrophic plan, you can't get financial assistance based on your income, but you could if you looked at the bronze plan. So I am going to plug, like, the catastrophic aren't as good as they're trying to make it out to seem. We've had some changes, like Claudia alluded to. We've had some changes in Champaign County. With Health Alliance out of our market, we only have plans through Blue Cross Blue Shield. There's a total of 10 plans this year, so we're looking at a smaller group. The premium increases for the plans in our area specifically are estimated at 30%. And we'll talk a little bit about why that is. It's the tax credit, it's the enhanced tax credit. And again, to go back to the ways that insurance is made affordable, these things still exist. The tax credits, advanced premium tax credits still exist. You're still gonna find out if you're eligible for advanced premium tax credits. And we'll talk a little bit about those income levels, where those are at. That's at 139% and 400%. And then for folks who are kind of in the middle of this, between 139 and 250, they are also eligible for discounts on deductibles and co-pays on silver plans. And then again, for folks who are under 38% of the federal poverty level, those were folks who would be eligible for Medicaid. So if your income is below that, and I'll show y'all some income guidelines soon, we would be talking about Medicaid, and navigators can also help you apply directly for Medicaid. A tax credit is a refundable credit that helps reduce premiums for health insurance through the health insurance marketplace. Most of the people in the marketplace are going to qualify for a tax credit. The tax credit can be taken in advance and paid to the health insurance company to reduce the premium, or it can be paid at the end of the year in a lump sum. But again, the idea is for you to possibly take it in advance to reduce the cost of your premium. And these tax credits change every year with the federal poverty level. So even if your income were to stay the same, you might be eligible for an additional tax credit because it does go up every year with the federal poverty level. And you can only get that through Get Covered Illinois, going through the marketplace. So that's how you would get that financial assistance. Cost sharing reductions, that's what we talked about with those deductibles, co-pays, insurance. Cost sharing is what those are called, and so when you reduce those deductibles or co-pays, they call it a cost sharing reduction, and that is specifically going to apply to a few folks who are in between those income levels that we talked about. I don't know if y'all can see my cursor. So this is our Medicaid line, 138. So if you are here and below, we're gonna be talking to you about Medicaid. This is the number of people in your household. And then when we go up here at 250%, this is the highest limit for getting that cost sharing reduction, where you get reduced deductibles and reduced co-pays. 400%, this is going to be the limit for getting any kind of financial assistance at all. Before the enhanced premium tax credits, we're going to go back to this being a cliff. It used to be, with the enhanced premium tax credit, you could be a little bit over this and still get a significant tax credit because it was enhanced. But now this is kind of going to be a cliff, where it's like, if you're over this, you're not going to get any financial assistance to help with health insurance premiums. So you've got this in the PowerPoint, and then we have kind of like a abbreviated version on the green handout called health insurance options. And now, what counts as income? So this is kind of difficult sometimes, but so this is another way that navigators can help out if you've had a lot of changes in your work throughout the year, so it's really difficult to predict what 2026's income is going to be. That's a good way to talk to a navigator and to kind of be like, maybe let's work this out together. So again, you want to add up any jobs or wages that you've had, any tips, net income from self-employment. So again, if you are you want to take out any business expenses if you're trying to report your self-employment income. Again, navigators can help you do that. Any unemployment, Social Security payments. I know that you don't pay taxes on those Social Security benefits, but those are considered income as part of the health insurance marketplace. So that will be considered, so disability payments, but not SSI. So now we can jump down here. Child support is not applied to this number. Gifts, SSI, veterans disability payments, workers' compensation, and then proceeds from loans. So those are going to be things that are not counted as income, but other things, pensions, rental income, alimony settled before 2019, all of those things are going to be counted as income. And then one of the big things that the ACA brought about was the expansion of Medicaid all the way up to that 138% of the federal poverty level. Expanded Medicaid is free, and it is accepted at local organizations. It's free. It's called the medical card, the public aid card, and it covers the 10 essential health benefits, just like the private plans offered. So we do encourage people, if your income is below that 138, let's talk about Medicaid. If the marketplace sees your income, they're not going to let you buy a plan with financial assistance. So you would be on the hook for the full cost of a private plan if your income is below Medicaid levels. So there's really kind of like, you can find out if you're eligible for Medicaid or for the marketplace, but they're not going to give you financial assistance if your income is below the level where you should be getting Medicaid, because they don't want to offer financial assistance if there's a program available for you. So again, if you have questions about income, that's somewhere where a navigator can help you talk through it. And I will bring up Chris Garcia to talk about getting ready to enroll.
Oh, there's a quick question up there.
Yeah.
Well, what happens when the Medicaid cuts take effect?
Oh, lady, that's.
Yeah, so we're gonna talk about that. Yeah, we will have to keep up to date, right? Like we'll be moving people into the marketplace, right? So now when Medicaid changes and the rules change, we'll be taking people to the marketplace and saying that they no longer qualify due to work requirements. So
We did, sorry, Chris, but just so people know, we did do a community meeting on the One Big Beautiful Bill Act to talk specifically about those cuts and when they take effect and all that. We do have information on our website about it, so, and then we can do something again a little bit later. We're gonna keep sticking with this whole topic of health insurance and its affordability and what's happening as it's unfolding. The big issue is the work requirements and when those start taking effect, and we just basically call those paperwork requirements because that's really all they are. But yeah, that's a whole huge topic. I don't blame you for your question, but yeah, that's big.
All right, so we're going to keep driving the Get Covered Illinois just because I know we're going to have issues next year. We always have issues with folks getting scammed with different websites and stuff like that, so we definitely encourage you to take that back to people you know to kind of spread that word.
take the pens and leave the places.
Take all the swag that's back there that they're sending us. It's to make sure that people really get that brand in their brain and remember, and we have this lovely cloth up front to remind you it's Get Covered Illinois.
So for those of you that are ready to set up an appointment, want to go through and kind of explore what your options are, the key parts that you're going to need to bring to the table are your family. We have to verify identities, social security numbers, all that stuff, and income. Typically, your last year's tax returns are a pretty good example, unless that does vary if you're self-employed or you have kind of changing income. Then we can do pay stubs or other forms of income to try and kind of figure out where you fall within that federal poverty level. If you have a preference, where do you go to get care? Your hospital facility, your specific doctors, bring that as well. Your prescriptions, everything essentially that you want to make sure that's still going to be covered, bring that so that we can actually go through the plans themselves and kind of go step by step and point by point. Same thing for Medicaid. So we want to kind of encourage you to, again, like Adani said, there's no wrong door. So whatever the need is, there are programs for manufactured or not manufactured, for prescriptions that are provided directly by the pharmaceutical companies if they're not covered by insurance, and so we can kind of explore all those options as well. So I did a kind of quick glance at what the plans will look like for next year. We just got these, I think.
How old is this person?
Yeah, 2 days ago, yesterday or so. So this is for someone under 30. So this is, I just kind of did the most obvious common one, a 26-year-old who's aging out of their parents. They're now on their own, and so they are roughly at about $30,000 a year. So you see that the 10th plan that they get is that catastrophic plan. So they're not going to get any subsidies. They're just paying to have the plan. They're paying a lot for that plan, and it's not really gonna cover anything other than that one wellness visit, and their primary care. So, super high deductible. We'd have to go into the details to figure out what the, labs, diagnostics, and all that stuff, but for the most part, none of that's gonna be covered. They're gonna be paying 100% for all those services until they've reached that deductible. So again, this is the market, assuming this is a healthy 26-year-old.
So these are all for 26-year-olds?
Yeah, this is just kind of the one,
So
yeah.
like, in someone in their 30s, it would be different numbers?
So the range would probably be, this would be from 26 to about 30. And then silver. So in the silver is where they see the most in cost sharing reductions and lower deductibles. So it goes from, thousands to hundreds. So this is where they're gonna get kind of the most bang for their buck. I did a comparison to someone who is 50 with similar income, and what happens is that the silver plans and the gold plans swap in pricing. So for gold plan for a 26-year-old, they can still save a lot and have a really good plan essentially, but that's flipped for someone who would be 50.
Wait, let's take a moment to appreciate this, because this is weird and we don't understand it at all. But like, a gold plan for somebody in these younger ages, so gold, remember, is very robust coverage, reduces out-of-pocket, maximums, $1.67 a month. What? We don't know why that is, but hey, if somebody can snag that and it works for them, go for it.
A certain age for those?
Yeah, yes.
Yes, so this is a 26-year-old, so this would be for someone under 30, essentially.
This is for somebody under 30, and for some reason, in Get Covered Illinois, for our area, gold plans for young people in the marketplace are weirdly affordable. We're not sure what that's about. Hopefully it stays that way. One of the theories about it could be that insurance companies are really afraid of losing young people, right? Because, you kind of balance the costs in your pool by making sure that you have young people as, to kind of balance out the cost of older people. But, so, please continue. I just wanted to make sure that people really see this.
Yeah, no, I had to do this a few times to kind of double check that it was actually correct, because I did it for a 26-year-old, for a 30-year-old, and 35, and kind of just kept going. And so then at one point at that 50-year-old age is when they flip. So they're definitely trying to kind of expand the pool. What was that?
Do they all flip?
Yeah, so it's all based on your age and your location. So this was a 61820, I did 61822, 61801. In general for Champaign County, it's gonna be about the same. It's the age that's really triggering that price swap.
And this is all marketplace, not Medicare or Medicaid? Right?
Yeah, just marketplace.
So part of the search thing there, which also is on the marketplace.gov, is that you could enter in your doctors, hospital, but according to Get Covered, I went in there today and did the same thing. These plans don't cover anything that's local.
Yeah, so I did the same thing.
Yeah.
I put in, Carl Foundation, Christie, OSF, for here, for Monticello. I did a pretty broad search. For the most part, we think that that's just kind of the website not caught up yet with the providers. So with Blue Cross being the one company in town, all these contracts had to get renegotiated and kind of try to expand their services, because there were issues in the past with the network adequacy with Carl, for example. So I did the same search and I put in all the providers. I think you can do up to 5. So I did specialists, general practice, family practice, and it kept saying, no, not accepted, not accepted, not accepted. You'd have to go into the plan specific like summary on like the Blue Cross website and then plug in your doctors under their search engine, and that'll give you a more accurate response to like who is in network.
Yeah, I just did that, and my 4 providers are not here, but 3 of the 4 were on the Blue Cross.
Yeah, so I think
So,
it's
yeah,
it's mostly
not
just the
fine.
get covered search component isn't matching quite yet what is in the network. So it is an extra step you have to go through to go to the actual plan itself to kind of get those details. We're definitely giving them feedback to say, hey, people that are doing that kind of search are going to see that there's no covered providers and are going to be, you know, essentially.
During Q&A, we can look at the website. I'm connected to we can look at the website and I can show y'all where to find the provider directory.
And usually, and we'll let you continue, Chris, but usually like with, Medicare.gov, on the Medicare side of things, a lot of times we will advise people that like, you don't necessarily want to be selecting your plan on that the very first day that everything is there, because sometimes stuff is still being tinkered with and information is still being seeded into the thing. And remember, this is the first year. This is the first enrollment cycle that Get Covered Illinois is up and running. So it might take a little while. I mean, you can do the extra work that Chris did, or you can, you know, wait a few days, maybe not try to sign up right on the first, you know, give them a chance to get everything loaded in there so that you can see real reliable information.
Yeah, we saw the same thing when healthcare.gov
Yeah.
essentially rolled out. So the first year, second year, it was still a little finicky and kind of hard to navigate. So eventually they got their stuff together. I'm assuming it's probably the same thing. So definitely if you try the search engine that's built into Get Covered, don't be discouraged. You can do a little deeper search and then you can find and actually see who's in network. They have a little kind of pop-up that says our search engine is essentially fueled by providers self-reporting. So if they haven't like updated their own stuff, it's just not gonna show up. So we're giving them the benefit of the doubt.
Is BCBS just the only one that's on Get Covered Illinois, or?
Yes,
For
for our county, yeah.
Yeah,
Okay.
because Health Alliance went away.
Are there others that are going away?
No.
Okay.
So other counties have other,
Okay.
Yeah.
it's just for ours, we only had the 2, now we're just down with the 1.
Yeah, we only
Oh,
ever
I
had
see,
the
okay.
2 for our geographical area, Health Alliance and Blue Cross Blue Shield. Now it's just Blue Cross Blue Shield, but like 10 different plans or something.
Yeah,
That
10
totally answers it.
10 for under
Okay.
30, if you're above 30, then it's the 9. 3 bronze, 3 silver, 3 gold. That 1 catastrophic is the extra one that younger folks got. So just some glossary terms again, stuff to kind of keep in mind when you're shopping, looking at those more detailed specifics under the plans. You can still go to the plan details and find the summary brochures. You can print those, you can download those. If you set up an appointment and you have questions about a specific one, you can bring that with you. I think it lets you like email it to yourself. If you want to send yourself the like summary of that specific plan. So a lot of ways that you can kind of be a little more prepared when you're getting ready to sign up. And then again, we're really pushing the Get Covered because your plans are not going to roll over. We imagine a lot of people are going to ignore those letters they got or just not be in tune with what's going on and are going to assume they will probably get a letter instead that says, now you owe us $1,500 in a premium, or your plan went away, we gave you something, or you're just out of coverage. And then if you miss that window, that January 15th, without that special enrollment, they're really gonna be strict about qualifying for those special enrollments, and so if you don't have a qualifying event, there's really not much that we're gonna be able to do.
I got a letter that shows that hers roll over to Blue Cross.
So if she had a Blue Cross, that
She
I
had-
didn't, I
You
got a
didn't?
couple letters.
Yeah,
I got.
I got the same
Yeah, I
letter.
just
You
said.
have this now.
Can you believe it?
Yeah.
Can I see your letter?
Yeah, let's see your letter.
So typically they would
I love this
say,
stuff.
But it says renewed, and I'm like, no.
usually they would say, here's a comparable plan that's what like what you had.
I never, I mean, I
But
had,
they don't.
I had a Health Alliance Gold.
Yeah. So potentially, because they're giving you that unique code to claim an account, essentially, they've already made one for you. You just have to go and claim
Oh, I
it with
did.
that. Yeah.
Yeah.
So.
Thank
so-
you.
Yeah.
I guess in their view, they're trying to facilitate
Yeah.
the switch into Get Covered.
Can I believe the premium tax credit? Because I like
I would go with.
I would-
I would update,
it.
yeah.
We're good?
Yeah.
I mean,
I just wasn't sure.
the income guidelines change every year, but assuming they did it right and they're
This can't be.
using the appropriate ones, it could be right. But I would still double check and just make your account and just have all that stuff, electronic copies of everything.
Definitely.
If you didn't receive that letter, you can still make an account, so it doesn't disqualify you, just, some people are getting that notice a little earlier on. So again, as Adani said, there's no wrong doors, so if you go to Get Covered and then you become, or they deem you eligible for Medicaid, it'll be sent to the state. I think Abe is doing the same thing, so if you are over income, they will kind of push your information up to Get Covered. You can call the Get Covered phone number, that's that 866-311-1119, or you can call us and we can kind of help you navigate that.
Thanks. Get Covered has not been they were like very recently like, we're sending out letters, and we were getting calls from people who got letters about codes to access accounts. But the idea is that if you have Health Alliance, you aren't getting a Health Alliance plan again. So just, you want to know what's in that application, right? Because it's based on your income, and come tax time, if your income is reported differently than what is on that application, you will be held responsible for that, right? So you want to know what's on that application, so I do encourage people to be proactive, but that's a good sign. This is a good sign that they are trying to automatically roll people over, so this is very good. But yeah, so that is a legitimate letter. It's from Get Covered Illinois, so we're on the right track, but they just like didn't tell us that they were sending out letters to everybody, and we're like, I don't know what you're saying.
For telling us.
Thank you.
I also received an email that was just
Perfect.
saying, because you're losing coverage, you're gonna have to go and get a plan.
Yep.
Then I got this.
Yeah, so there has been, so it's good that there has been a transfer of information from healthcare.gov. So again, like I said, this is a legitimate transfer of power, I guess. And so it looks like people are gonna be able to claim their accounts, and it is gonna remember some of their information. So I do think that this is a good sign. Hopefully this makes it easier for all of us as we're helping set up accounts and stuff, that it will hopefully remember your name and your email and your address, so we won't have to make big updates like that.
So the application should be in the box somewhere? In other words,
This would be your question.
this is supposedly approved, but the data they used, in other words, the application, you'll be able to go in and look at that?
Yes, so we should be able to go in and like, just like we had an account on healthcare.gov, we should be able to log into Get Covered Illinois, and you're gonna be able to see kind of like what the information they used, what is the information that they use, and go in and edit it.
Yeah.
So that's my hope.
Yeah, I
I
didn't
didn't
see
see
that.
this there.
So y'all created your account. We'll talk later.
Okay.
But yeah, so we'll have to find out what this looks like. They have not told us what it's gonna look like when we log in. We've like
Okay.
just now created our accounts,
Okay.
and they don't have anything on them.
Fair enough.
So the enhanced tax credits, in 2021, the American Relief Act increased tax credits for consumers, and now they boosted the tax credits, and so they became known as the enhanced tax credits. This made financial assistance for premiums much more robust. It made your premiums cheaper. Right now, those increases will expire at the end of December. Tax credits are still available, but they'll go back to the reduced amounts before 2021. Congress is negotiating extending these enhanced premium tax credits as part of the shutdown, so that's something that people have already talked about here. So negotiating is a really generous term as well. Trying to be very fair. So we are keeping an eye on that, but it looks like what we're seeing maybe I'm gonna be hopeful, we'll see. I might take it back tomorrow, we'll see what happens. I also wanted to talk about the family glitch. One of the big issues that we were having with folks is that if they were offered, or if someone in a household was offered an employer plan, they usually were not eligible for financial assistance for coverage for those other people, for that dependent coverage. So the family glitch means that if you are part of a household where there is employer offered health insurance for other people besides just the employed person, you can actually qualify for financial assistance based on the premium for that dependent and not based on the premium of that employee who usually would get a cheaper premium. So that has been corrected, so that was very exciting for us. So that means if the dependent coverage that you have through an employer is unaffordable at 9.96%, then you can qualify for financial assistance on the marketplace. So that used to not be the case. And just in case anybody had any questions about this, the individual responsibility payment is no longer enforced. So it used to be that if you did not have health insurance, you would be fined. That fine has now gone down to 0. So if you file taxes and you don't have health insurance, you will not be fined. So it will not be an issue. So for people who are facing much bigger issues or bigger costs with their health insurance, that is something that we want to let people know about. You won't be fined, you will just have really high healthcare costs potentially. We can start taking questions, but I also was gonna just go ahead and maybe log into the website so that we could see it. Or I'm not gonna log in, I'm gonna do the C plans. So, nope, I don't know how to do this. So here's our website, Get Covered Illinois. What you could do right now until Saturday, basically November 1st is when you can actually start enrolling in the plans. But what you could do the rest of this week is you could go to Plan Choices and we could compare health and dental plans, and that's gonna get us set up to this little questionnaire. So I'll just put down 61820. Let's do 62. All right, I heard a 62. So I'm just gonna do one person to make it a little bit more straightforward, and we'll do 45,000 a year. And so when you take a look at this estimated tax credit, this is the amount of financial assistance. This is not the cost of the premium. This is the amount of financial assistance that you might be eligible for. Again, this is an estimate. We are window shopping. Based on the income you entered, you may qualify for a tax credit.
And that amount is per month?
Per month, correct.
How much is it for this very cloud?
2561.
2,561.
And so yeah, I'm gonna, does anyone have a doctor that we could try to look up? I think it's still kind of messed up, but.
Dr. Hampton at Carl?
Simone?
Yep.
Yes.
Yeah. Ooh, love Simone. Did she get added? No. Come on. Okay, so you have to select it, otherwise it won't.
Oh, so you can't just type it in?
Right, yeah, you have to like choose the person.
Okay.
And that sounds right, at Carl. And then it asks you some questions to try to assess what your healthcare usage is. So how many doctor visits per year? We can leave it at 3 to 4 times. How many prescriptions do you have? We can say 3 to 4. We can do a atorvastatin. That was a suggested one, so you want to select it out here. We'll do 40. We'll do Adderall as well. And then, what's another good one? Lisinopril?
Yeah, sure.
Y'all didn't know there was going to be an activity, did you? So we'll just do 3 for now. And these are asking for specific benefits. The health plans do not include dental, unfortunately. They only include like children's dental, and that's only some of them. And then acupuncture is also an option.
Oh, that's cool.
So here we are looking at the gold. So this is still working for our person born in 62. So looking at $5 a month. This was at an income level at $45,000 a year. You can see a primary care visit is $30. Generic drugs are $15. The deductible is $2,000. When you look at the details, it'll expand it. Yeah, it's showing someone is not covered, but then, so what we would do in this case, like if you were in my office, we would go to the provider directory. You can kind of see this little, I don't know why this disappears. I don't like that it disappears, but summary of benefits and coverage. This is the document that's going to list everything. I'm not going to go to it, but it's a big PDF. It's very dense, but it does list everything in those simple terms. Go ahead, yeah.
What's the difference between the deductible and the out-of-pocket maximum?
So think of them on top of each other. So the deductible's here, and then the out-of-pocket maximum is the ceiling. But the deductible is where you get your first discounts on services. So the deductible is going to come in play only when you see percentages. So if we were to look down here, you can see this PPO does cover out-of-network services. And when it says percentage like that, 50% coinsurance after deductible, that's when you're clued in, okay, I have to pay the first $2,000 of an out-of-network primary care visit before I'll get it discounted. So because a primary care visit probably isn't going to be $2,000, you're just going to have to pay that primary care visit out of pocket, like the $200 that it costs to go to an out-of-network provider until you hit that deductible.
But then once you hit the out-of-pocket maximum, then everything is covered?
Yes. Correct, exactly. Yes. So the deductible is kind of the first step to start getting discounts. You can see here lab services. Lab services are in-network, you're going to get a 25% discount once you've paid $2,000 worth of any services, right? So the deductible is for covered services, but it does not include premiums.
But going down, it says generic drugs, in-network, $15 copay. That's, you don't have to hit the deductible to get that then.
Yeah, usually if you have a deductible, so co-pays are like that set dollar amount, right? Like a $25 office visit. Co-insurance is when it gives you that percentage, 50%, 20%, whatever it is. If you have a plan that does have a deductible, when you're paying co-pays, whether for prescriptions or office visits, things like that, that doesn't count towards your deductible. What counts toward your deductible is when you're getting services that require co-insurance, and then you're paying on a deductible, and then once you meet the deductible, then you'll just have to pay the 50% or 30%, 20%, whatever it is. But the deductible does count towards your total out-of-pocket limit.
So you can see here the emergency room services that is 25% coinsurance after deductible. So let's say you go into the emergency room and it's a $2,000 visit. So you've met your deductible, but now if you go to, your $6,200, your out-of-pocket maximum is now $6,200 because you had a visit where you paid card into that. Yes.
Is that $2,000 deductible per plan per year?
Yes.
Or per drug or visit?
No, per plan per year.
Yeah. So it resets at the beginning of the year.
Yeah.
Okay.
What is the out-of-pocket maximum not cover? I mean, presuming you've spent $8,200, what thing's going to continue to charge you for?
So depending on the plan, so we have a PPO here, so it does cover some out of network, but the thing that I will actually clear this out. So the problem is that they'll kind of play, you'll see here the out-of-pocket maximum for in-network is $8,200. Non-participating, so out-of-network, is actually unlimited. So when you're out of network, that's not gonna count.
Yeah.
So you can get some discounts after those deductibles, but you don't have an out-of-pocket maximum if you're out of network.
And that's part of why when Chris was talking about getting ready for when you're gonna go look at plans, that's why knowing the providers that you wanna make sure are covered by your plan is so important, because you wanna keep you want a plan that has your providers in network, so that you get the most benefit from your health insurance with the out-of-pocket maximums and things like that.
There's only one insurance.
Yeah, how can we be out of that?
We're hoping Carl's covered and Chris is
Yeah,
covered and.
I think Carl is definitely expanding their, Blue Cross, Blue Shield, stuff, because
Yeah.
Health Alliance has gone away, and so Blue Cross Blue Shield is kind of, for stuff like this, and a lot of times for employer-based plans, that are non-governmental, it's kind of the only game in town. We're in a really weird insurance market, so,
Any intel on Christie?
Yeah, Christy does accept. So when we go directly to the website, so Carl, they've got a page, health plans accepted. Sorry.
maybe what we can do, Adani, sometime next week, we'll send an email that includes all this information, including a link to the video, the PowerPoint, things like that. Maybe what we can do is also include the link to where y'all can look up Carl, where they list the plans that they take, and Christy, where they list the plans that they take. That way you don't have to try to find it yourself, because I know with Carl, if you kind of Google it, you can end up in like 4 different places, and there's like one good place where you can really see all the information. So we'll include that in the email that we send out. If you're not on our email list, make sure that when you sign in, that you put your email on the sign-in sheet, and we will go ahead and add you, so you can get that update.
So if you have to go to Mayo Clinic, that's 100% out of pocket.
So depending on depending on what you're doing there, right? Because these PPOs do have out-of-network coverage, right?
Mm-hmm.
Yeah.
But I mean, you're getting some discounts, but yes, you're going to face much higher costs out of network.
Yeah.
So 50% co-insurance after deductible, but no out-of-pocket maximum.
Correct.
Or out of network,
Okay.
So depending on the services that you're getting, so one of the things that you could do, if you're getting a service because no providers in this area can provide that service, that can be paid for by your health insurance company as in-network, if your doctors are on board to fight with the health insurance company to say that no one can do this here, only these people can do this here, so it should be covered as in-network. So you basically have to fight with the insurance company.
Yeah, and if that fight is difficult, we can also help you appeal we can help you file an appeal, and then if that doesn't work, then we can help you file a complaint with the Illinois Department of Insurance. And when they start an investigation, they're usually pretty successful at resolving things, but you have to start internally with like an appeal to your insurance company.
Does in-network typically, since it's Blue Cross Blue Shield Illinois, does it typically only include Illinois hospitals? Like what about Chicago hospitals like Northwestern Medical that has a lot of...
So that would depend on the actual specific hospital, because some of them are in network, right? Blue Cross Blue Shield is a national company, and they do have a wider network, but generally you want to be careful if you're going anywhere out of state, and definitely you want to double check if you're getting care. That's why it is important to be working with your doctors and talk directly to the health insurance company. Hey, I need to get this very specific procedure that no one else can do, and I'm going here. What prior authorizations do I need? What paperwork needs to get done so that it can be covered?
Health Alliance was a POS. This says PPO.
Mm-hmm.
Can you explain?
Yeah, so PPOs are meant to be the most flexible, but they are going to be looking at what the PPO is meant to be most flexible. A POS does ask for some prior authorizations, but PPO is meant to be the most flexible. So you could just walk into a primary care and pay your, up to your deductible and then get that discount once you've met your deductible, that 50% discount for primary care. So PPO is meant to be the most flexible.
Yeah, so like HMO is the most restrictive, right? And, in our community, it hasn't been that bad because some people had Health Alliance HMO like we do through our employer-based health insurance. But it has both Carl and Christy in network, but it might not have Northwestern in network. So HMO is the most restrictive, then PPO, which is Preferred Provider Organization, is that what that was? Yeah, so they have preferred providers. That's kind of like, the network, but they will cover, outside of that, for a less preferred provider, but this is part of why it's really important to, if there's people in this room who get health care from other places out of town, it's really important to do that homework and look at the plans and see if they'll cover you going to Northwestern or to Mayo or,
I can refer to POS as being like a gated community because you'll still need a primary care physician for most POS plans that allow you to go towards your out-of-network benefits through a referral process with your insurance. Right?
Okay, right.
So but the PPO plan, typically it's set in stone because you have access to your out-of-network benefits without that gate, without your primary care physician.
Okay, yeah, that makes sense. So I forgot about that some plans do require you, let's say you need to see a cardiologist. Some plans do require you to get a referral from your primary care provider before you can go see that cardiologist and have it paid for. And then other types of plans, you might just be able to call up and make that appointment. That's what you mean by the gatekeeping, right? Yeah. Thank you, Ashley.
We would encourage anyone that has those different facilities to look into their hospital financial assistance, because if you're in network or even if you're out of network, they do have some caps that they can still apply some discounts to.
So health insurance is fun. Can we do anything else y'all want to see through these plans?
I have a question. Again, how do you find the provider? You're looking at the Simone.
Yeah, so I was trying to look up Simone. Simone didn't show up in the.
I think you were in the wrong zip code. Zip code.
Oh. So up here, I clicked on this plan, and then up here at the top, there are these little headers, and you're going to look for provider directory, and it's going to take you to the specific Blue Cross Blue Shield directory.
It has you in Morden, Illinois.
Okay, sorry.
Oh.
Thank you.
Yeah.
That's annoying.
Okay.
Okay. Let's try Hampton. Oh, here, yep, you called it, Chris.
So if you're searching for a Muhammad doctor, you need the Muhammad zip code in there.
You can also, usually they let you change the mileage so that if you are looking for, I was really far away, but it's I think they sometimes let me use a bigger mileage, but maybe not. Never mind.
I think it's 25 or yeah.
Yeah, so we did find Simone, and then, Kuhlenschmidt is a Christie doctor.
Yeah.
And he's also part of the network. So you can look over here in the Blue Choice Preferred PPO, Brown, Silver, Gold network. So they are, yeah. So Kuhlenschmidt is
my actor.
Yay! Bingo!
He's very popular. Very popular. We picked two of the most popular doctors.
So that's how you would look up a specific provider. You would go directly to that provider directory. So each of those plans is going to have it on there. Once you click into the details, it'll just be right here immediately under there. You can also look for prescription drugs. Usually they'll give you a PDF, so you can Control F for some of your prescriptions to see if they're considered generic or what category they're in, tier 1, 2, or 3. Usually 1 is generic and the cheapest, and then they get more expensive as you get into the higher numbers. So that's how you can look up your specific prescriptions. I will close this out, and Claudia? Yes.
Let's say you enroll in the plan on November 15th,
Mm-hmm.
and then, as if by magic, the enhanced tax credits are restored on the 20th. You get a do-over?
So you're gonna have, we're gonna have to play that by ear. We're not sure what that's gonna look like. We hope that that's the case. Open enrollment is through January 15th, so if that gets changed in the middle of November, hopefully you will have another month to update that. Because again, if you're choosing after November 1st, you're picking a plan for 2026, so that wouldn't even start till January 1st. So hopefully we have time to do that. And then for folks in January, we would hope that they would give us a special enrollment for that because of the cost. So we're not sure yet. They have not given us answers about that.
The numbers you were showing up there was after rescinding the.
Correct. So these are 2026. Those are without enhanced tax credits. So
yeah, but that was for someone making 45,000.
that was
So
45,000.
If you put it over 62,000, it will look wildly different.
Yes.
Yeah.
Yeah, we don't have time to show every
Yeah.
variation.
But you can go
gradation.
home. This is your homework to go on to Get Covered Illinois and play with those numbers.
One thing I noticed was between this year, and I really analyzed this and got out the plans and I compared this year's with last year's. I noticed that this year, our medical expenses went up 5-10 times as much. I was like, why? And I saw there were a lot of things where, this year there was a percentage co-insurance, and the amount, that percentage of X was just so much bigger. And then last year it was I can't remember, it was a copay, or it was some set amount, and it was fairly small, $100. And this year, instead of 100, it'd be $1,000.
Yeah.
Is that just gone, that those kind of plans?
Yeah, so, so just as an example, at Healthcare Consumers, we're dreading this because we have a really good Health Alliance plan there's no deductible. Our plan is grandfathered, and we've only been able to stay on it because we've been on it forever. It wasn't even offered to the public anymore, but it was really robust. There was no co-insurance, there was no deductible, everything was co-pays. And for labs and diagnostics, and I'm somebody who has to have a lot of regular labs and diagnostics, there was no personal responsibility for it, no co-pay, no co-insurance. It was beautiful. And we're gonna end up with an employer-based health insurance that's a Blue Cross Blue Shield plan that is gonna have a deductible, and it is gonna have co-pays, and it is gonna have co-insurance. And so, that's the direction things are moving in. But basically, every year, plans are allowed to change things and tinker, and change things, even if it looks like the same plan you had as the previous year, it has the same name, but maybe they've changed the drug list that they'll cover. There might be changes to the network, or there might be changes where you didn't have co-insurance before, now you have co-insurance. And one of the reasons that I hate co-insurance, personally, as opposed to co-pays, co-insurance is because you have no idea what that cost is gonna be, right? It's based on the price that, let's say you get an MRI, and the co-insurance, let's say you have God help us, but let's say you have a 50% co-insurance on an MRI, well, you don't know 50% of what. The what is the price that's negotiated between the provider and the insurance company. So they negotiate a price, so presumably it's less than if you were just completely paying out of pocket. But it's still this question, you're not gonna know what you're gonna owe until you start getting the bills in the mail. And that's why for years I resisted changing the health insurance that we had, because I didn't want to move us to something that had co-insurance. Now we have no choice. But that's the ugly part about co-insurance, is it's a percent and you don't know what it's gonna be, whereas co-pays are fixed dollar amounts. So right now, our Health Alliance plan, if I go see one of my specialists, I'm gonna pay $50 out of pocket. That's the copay.
See my primary care doctor, $25 out of pocket. That's beautiful. Co-insurance is BS in my opinion.
Yeah, so unfortunately, we see, like, I can't rationalize what a health insurance company does, right? It's not in their, it's against their profit to pay for people's care, right? Like, they're not looking for ways to help and cover people. So unfortunately, we are seeing more and more of this, where they're choosing to just kind of leave it up to whatever the negotiated price is. And unfortunately, we don't have a system that corrects some of that stuff.
It says about 80 to 85% of the premiums have to go towards, and that includes not just premiums supposedly, but subsidies. No, so doesn't that mean that kind of creates a range that money like has to go towards
paying for people's care.
Claims.
And claims are getting more expensive. Right, like the cost. I mean, especially once we start seeing Medicaid cuts and people going without care, that's gonna be put on people who do have health insurance, right? So it's like those costs are going up a lot.
That 80 to 85% of premiums, that's, premiums what you pay every single month. The reason that the Affordable Care Act put that in and reined that in is because prior to that, insurance costs were just going up and up and up, but a lot of it was not for paying for care. It was going for like high salaries. I mean, they still get paid plenty of money, but it just kind of with the 80 to 85% requirement that 80 to 85% of the premiums paid have to go to the care that is provided. It's sort of constrained how much those executive salaries could go up, or advertising or whatever. So basically, more of the dollars that you're paying for in premiums are going to cover the cost of care. It was just a way to kind of rein in the out of control stuff. It's still out of control, but less out of control.
But that just shows you how much money there is in health insurance, right? Like, it's still out of control.
But going back, and I'm sorry, I think you had a question in just a moment, but like going back to that issue of co-insurance and co-pays, this is why it's really, really important to pay attention to that out-of-pocket maximum, right? Because that's really the risk that you're taking with the insurance plan that you select, right? Because insurance is all about risk, really more for us than for them. But when you're choosing a plan that has an out-of-pocket maximum that you feel you can live with, you're basically saying, if I need, health care this year, or a lot of health care, here's how much I know that I might have to pay total, but then beyond that, the rest will be covered. So it's up to each individual to sort of figure out what you can tolerate in terms of risk for that out-of-pocket maximum, because especially with co-insurance and stuff, it's possible that people will reach that amount. But that lets you know your level of risk. If I use a bunch of health care, I need to be prepared to pay this total out-of-pocket maximum. And if it doesn't come to that, great, but that's, so some people will be choosing plans where everything else is kind of equal in terms of the network, the prescriptions and stuff, but the out-of-pocket maximums will be different, and so that'll be part of the calculus to figure out if that's a plan you want to go with. Okay, hang on.
So if your enhanced subsidy is going away, you've been told that right now, is there any point in going out and looking in the broader marketplace, finding a broker or whatever, to just see if, is there another Cigna or Aetna or something else? What is your recommendation on that?
Yeah, I think that that's a reasonable thing to do. With the caveat that, like Congresswoman Nikki Budzinski and her colleagues are trying to bring this back. Trying to reinstate the enhanced premium tax credits.
There's a chance it could happen,
And it could even happen, as you were saying,
yeah.
after the fact, like in January or something, and then
Yeah.
if I did that, I would be out of luck.
Yeah,
I would be-
'cause you
Yeah,
wouldn't
once you're
miss-
outside of the market, that's different, right? Like, you don't
Yeah.
get a special, like, you get the special enrollment. They're really pushing these special enrollments for people who are already in the marketplace.
Yeah.
So if you're not on Get Covered Illinois or
Right.
getting your plan through there, you might not get a special enrollment if you're not already on the marketplace.
Right. Now, a year from now, I could look at it over
Yeah.
again.
Yeah.
Yes.
Yeah,
So I would
exactly.
be-
Yeah.
okay.
And I do want to reiterate, the premium tax credits are not going away. We saw someone get a tax credit, but yes, so check
Yeah.
Get Covered
No.
first, and then,
No,
yeah.
it's gone.
Okay,
Yeah.
okay.
But,
Okay,
but,
yeah.
but there's nothing wrong with going to talk to a broker if there's somebody you
Yeah.
trust.
Uh-huh.
If there's not, you can talk to me later, but,
Uh-huh.
there's nothing wrong with going to talk to a broker to say, I might still end up going through the marketplace, but
Mhm.
I'm doing my homework, and, and there might be a plan that is kind of, if you're losing that benefit of the enhanced premium tax credit, you might find a plan that actually, works just as well and maybe has lower out-of-pocket, expenses. There's nothing wrong with looking. The only thing I will tell you that y'all all probably know is when you go and talk to a broker and you look, they're gonna be pursuing you.
Yeah.
So you'll have to deal with the annoyance factor of
Yeah.
that. But
Yeah, I would try to get someone local, and then always remember, you do not have to enroll immediately. You know what the open enrollment is for Get Covered Illinois. So, you do not have to sign up that day. Usually the health insurance actuarial values are not set up to expire on the day. You're not gonna lose this deal, so
Right.
that's a red flag if someone's trying to make you sign up for something in the
People already
moment.
signed up.